Welcome to the Deep Dive. Today we're looking at something pretty transformative for healthcare leaders. It's the growing role of AI voice and chat agents.
That's right.
So if you're trying to figure out how these tools can boost efficiency, maybe improve the patient journey without getting totally swamped by tech talk, well, you're in the right place.
Absolutely. Because, leaders in healthcare are facing some real hurdles right now. Think overwhelming call volumes, staffing gaps.
Yeah, long wait times.
Exactly. And those frustrating appointment no-shows, all of this, it really hits operational costs and patient care quality.
Right. So what's the solution people are turning to? Seems like it's increasingly these AI-powered agents, yeah.
It is. You can think of them like virtual team members who are always on. They handle a surprising range of stuff.
Like what kind of stuff?
Oh, answering common questions, managing appointment scheduling, rescheduling, even basic receptionist duties, 204/7. Some even offer multilingual support.
Okay, so a digital receptionist, essentially.
Sort of, yeah. And our goal today is pretty simple. Let's explore the real-world benefits these AI agents offer. For staff, for founders, we'll keep it clear, professional, and skip the heavy jargon.
Perfect. Okay, let's dive right in. First, big headache. Those constant phone calls and patients stuck on hold. How do AI agents help there?
Well, the big thing is how they handle the sheer volume of routine calls. They can answer FAQs, give directions, route calls, all at once. And that immediately frees up your human staff. They can then focus on the more complex patient situations, the ones needing empathy and, real human problem solving.
Got an example?
Yeah, a good one is Intermountain Healthcare. They used a COVID-19 chatbot and saw their call center volume drop by, get this, 30%.
30%, wow.
Yeah, and that meant their agents could spend more quality time on those complex cases. Big impact.
That's huge. And it's not just about making staff life easier, right? It must directly help the patient experience, too. Faster answers, less waiting.
Precisely. Less frustration. When patients get quick, efficient answers, their satisfaction just, it naturally goes up. It makes the whole healthcare interaction feel a bit smoother, more accessible.
Okay, what about another major issue, staffing shortages, and the costs tied to that? How does AI fit in?
Right. This is key for operational efficiency. AI agents are great at taking over those repetitive admin tasks. The stuff that eats up so much staff time.
Like appointment confirmations.
Exactly. Confirmations, sending out pre-appointment info, maybe handling some initial intake details. There was a surgical practice, for instance, that automated appointment calls with AI. They cut their front desk staffing needs by a third. 33%.
A third. That's really significant savings.
It really is. And it's not just about maybe needing fewer hires. It's also about cutting down on things like overtime pay or the cost of using those third-party answering services, especially after hours.
Right. Speaking of after hours, patient needs don't stop at 5 p.m. How does AI ensure people can get help anytime?
That's one of the core strengths, really, the 24/7 availability. Patients can ask a question, schedule something, or at least get their query logged anytime. Day or night. Grove Medical in Perth, they use an AI phone assistant specifically for their after-hours calls. It means they don't lose patients just because the office is closed.
So the patient feels heard even if it's midnight. No more waiting till morning for a potentially simple thing.
Exactly. That continuous support makes a difference. Patients feel attended to.
And it's not limited to phone calls, is it? Chatbots on websites, patient portals, they handle routine stuff too.
Oh, absolutely. Chatbots are often that first point of online contact. They can instantly answer things like clinic hours, locations, maybe which insurance plans you take.
Simple stuff that clogs up phone lines.
Right. And it's a win-win. Patients get instant answers, and your staff get fewer interruptions for those basic questions. It frees them up.
Like having a tireless digital helper online.
That's a good way to put it. And some estimates suggest, a well-set-up chatbot can handle maybe up to 80% of those standard routine questions. Think about the time that saves.
Okay, now let's talk about something that costs practices a lot. Appointment no-shows. How are AI agents tackling that?
Ah, yes, the no-show problem. AI is actually quite effective here. These systems send out automated reminders, texts, emails, whatever works.
Just simple reminders?
Well, yes, but also more. They often give patients an easy way to reschedule right from the reminder if something's come up. Makes it frictionless.
And that actually works, just reminding people.
It really does. Studies show these kinds of systems can cut no-show rates by, sometimes up to 30%.
30% reduction in no-shows. That would make a huge difference to the bottom line.
Absolutely. And it gets smarter. Some AI can even help optimize the schedule. If someone does cancel, the system can automatically reach out to patients on the wait list to fill that empty slot quickly.
Ah, clever. So fewer empty slots, better clinic flow, and like you said, better revenue. It's a clear win.
Exactly. You maximize your resources, see more patients, everyone benefits.
Okay, so those are the broad strokes. Let's get a bit more specific. What about these AI voice agents acting as virtual phone receptionists? What does that actually look like?
Right. So imagine a patient calls your clinic. Instead of going straight to a human or a clunky old menu, an AI voice agent answers. It uses natural language processing to understand what the caller needs.
Okay.
Then it can do things like book an appointment, cancel one, check details, or, if needed, route the call to the right person or department. Like that Grove Medical example in Perth we mentioned, they're using it for exactly this.
So it's actually understanding and interacting, not just playing messages.
Precisely. It's conversational. And they can do outbound calls, too, for those appointment reminders or maybe post-visit follow-ups. The big pluses, consistent, polite service, fewer dropped or missed calls, better experience overall.
Makes sense. And then the online chatbots, how are they used for bookings and answering questions?
So chatbots are that instant helper on your website or portal. They answer those FAQs we talked about, but they can also handle appointment booking right there in the chat window. While Cornell Medicine, for example, they saw a 47% jump in digital bookings using a chatbot.
47% increase just from the chatbot.
Yeah, it shows how much patients value that convenience. It's like a digital front door that's always open. They can handle surges in questions, too, like during flu season or, a health crisis.
Right.
And many chatbots can integrate with your back-end systems, EHRs, scheduling software.
So they can give personalized info, like check insurance.
Exactly. Or pull up appointment history. They can even do some basic lead qualification, asking initial questions to guide potential patients towards specialized services if needed.
Sounds like they really smooth out that initial contact.
They absolutely do. Quick answers, efficient routing.
Yeah.
It lets your human team focus where they're needed most.
Okay, what about keeping in touch with patients after they've booked or visited? How is AI used for outreach and follow-up?
This is where the scalability of AI really shines. You can set up automated reminders for appointments, sure, but also for things like vaccinations, annual checkups, cancer screenings.
Keeping people on track with preventative care.
Exactly. And some systems are getting smarter. They might even predict which patients are, say, at higher risk of missing an appointment and send them more targeted or different kinds of reminders.
More intelligent than just a blanket reminder.
Right. And then after a visit, a chatbot could automatically follow up. How are you feeling? Any questions about your medication? That kind of thing. These automated touchpoints maintain engagement without burying your staff in manual calls.
So it seems pretty clear why healthcare providers are looking at this. What are the main drivers behind this uptick in adoption?
Well, a huge factor is the pressure on the healthcare workforce itself. Staffing shortages, burnout, these are really pushing providers to find efficiencies.
Makes sense. People are stretched thin.
They are. And doctors see the potential. The American Medical Association found something like 68% of physicians see AI helping, especially with cutting down that administrative workload. There's just a huge demand for automating routine tasks.
So the need is there. Is the technology keeping pace? Are these solutions readily available?
Yes, definitely. The market for these solutions is growing rapidly. You've got specialized vendors popping up like Curious Thing AI here in Australia, plus the big global players, Microsoft, Amazon. They're all getting involved in healthcare AI.
So it's actually becoming more accessible for, say, a local clinic to implement this, not just big hospitals.
That's right. Many are cloud-based now, which makes implementation easier. And they're getting better at integrating with existing systems like your electronic health record, your EHR. That integration is key. And the market growth predictions are, well, they're pretty staggering. The voice assistant market alone is projected to hit nearly $27 billion globally in the next few years. Plus, you're seeing governments in places like the UK and here in Australia taking notice, launching initiatives.
Okay, so it's not just hype. There are real results happening now. Can you share some more concrete examples of the impact?
Sure. Remember that NHS trial in the UK? Their AI voice bot fully resolved 42% of the calls it handled, end-to-end. No human needed for those.
Wow, nearly half.
Yeah. And you show to hospitals in India, they cut call traffic by 31%. That saved them about 9 staff hours every day. Think about what staff can do with that time back. Probably boost morale, too, not having to answer the same basic questions over and over.
9 hours a day. That's more than a full person's shift. What about labor savings or handling busy periods?
Well, we mentioned that surgical practice cutting front desk needs by a third. There's also an orthopedic clinic that saved over 95 hours of staff call time per month using a chatbot. 95 hours. And AI gives you that ability to handle sudden surges in calls without scrambling to hire temps.
Okay, and back to the no-shows. We know reminders help, but are we seeing real-world drops in those rates?
Yes, definitely. Some federally qualified health centers using AI scheduling assistants have reported really significant drops, often in that 30% range we talked about. Fewer empty slots means better attendance, which flows straight to better financial health for the clinic.
And the bottom line for the patient,
Yeah.
how does all this tech impact their actual experience and satisfaction?
Well, the potential is definitely there for higher satisfaction. Getting help 24/7 via chatbot, getting faster answers, that's usually seen positively. Some studies even found patients perceived AI answers as empathetic and thorough.
Really? Empathetic?
Surprisingly, yes, in some contexts. But,
Yeah.
and this is crucial, you have to have an easy way for patients to say, okay, I need a human now. That seamless escalation is key for trust and acceptance.
Absolutely. The AI is a tool, not a replacement for human connection when it's truly needed. Okay, last piece on results. The financials. Is there a clear return on investment here?
Oh, absolutely. When you cut down no-shows, book more appointments successfully, automate tasks that used to take staff hours,
Yay.
that directly protects and often grows revenue.
All right.
Some hospitals implementing AI in their contact centers have reported saving 6 figures annually. Plus, think about the competitive edge. If your practice is easier to reach, faster to get answers from. Patients notice that.
Okay, so looking crystal ball time. What's next? What kind of AI are we likely to see more of in healthcare communication?
Well, right now it's mostly natural language processing and machine learning driving the chatbots and voice bots we've discussed, understanding language, learning patterns.
Uh,
There's definitely growing interest in generative AI, things like large language models for more nuanced conversations, maybe even patient education. But, there's caution needed there around accuracy and reliability in a medical context.
Sure, makes sense. High stakes.
Very high stakes. For now, the big demand is still firmly in AI for appointment management and handling those common FAQs reliably. And good speech recognition is becoming even more critical. We're also seeing more AI tools designed to assist clinicians directly, but that's maybe a parallel trend.
Okay, so if a healthcare leader listening is thinking about adopting this, what are the absolute key things they need to consider?
Number one, reliability and security. You're dealing with sensitive patient data. Privacy compliance, like HIPAA or local equivalents, is non-negotiable.
Right.
Integration is huge. Does it work smoothly with your existing EHR and other systems? Can it actually understand what patients are asking for accurately? Is it configurable to your specific clinic's needs? And honestly, does the vendor have a proven track record? Look for case studies. Talk to their existing clients.
Good advice. Okay, so let's wrap this up. What are the main takeaways for healthcare leaders tuning in?
I'd say the core benefits are pretty clear now. Better operational efficiency, lower costs, definitely an enhanced experience for your patients, and importantly, higher satisfaction for your staff who get relief from repetitive tasks.
And it's about augmenting human capabilities, not replacing them entirely.
Exactly. That's the key message. AI handles the routine, freeing up humans for the complex and the compassionate.
Yeah. And it seems like this isn't slowing down. We'll likely see more of this in Australia and globally.
That's definitely the direction things are headed. Adoption is accelerating.
Okay, so here's a final thought to leave you with. How could your organization strategically use AI to tackle its unique communication bottlenecks? How might you create a healthcare experience that feels more responsive, more efficient for both the people you serve and the people on your team? Definitely worth exploring the AI solutions out there. Thanks for joining us for this deep dive.